Welcome to this demonstration by TreeAge Pro about some of the new features added in 2018 to help you build models which need to be run with parallel trials. A couple of examples of microsimulation models where you may need to have patients synchronized by time are limited resources, where you may need to allocate resources as individuals in the population need or then release them, or models where the state of a patient, for example if they're infected with a disease, can impact other patients directly, such as an infectious disease model. This brief demonstration will show you where to access the tools you need to begin using parallel trials. So this model that we have open here, Parallel Trials Q-Global Tracker, can be found in the example models, so in the project's view, under healthcare. It's an example of a model that uses limited resources to demonstrate the new stop node. This node allows patients to wait for resources to become available. Let's have a look at the model. In this model, any trials who need the limited resource of a treatment wait until the other trials have been processed before checking available resources. They're healthy, they get sick and need treatment, and they wait at the stop node here. Alongside the stop nodes, this model is going to use global trackers to record how many trials have the resource. Global trackers are associated with the whole model and allow individual patients to read and write data required by all the trials in the model. In this example, we're using global trackers to count how many resources have been taken. So at the stop node here, we use logic which checks the global trackers to see how many treatment resources are taken or used. You can create new global trackers in the global trackers view down here. Before running the microsimulation, we'll note that enhanced time reporting is turned on via the tree preferences. Running the microsimulation with parallel trials is the same as running any microsimulation, with the addition of checking the box here for running parallel trials. And we'll check the value of the trial sets to be the average, so the expected values rather than the sum. The enhanced time reporting allows you to consider where each trial in each strategy was in time. You can select each of these reports here and examine where all the individuals travelled in time. The cohort report allows all trials' health states over time to be aggregated and reported back via the state probability graphs. And you can use these to validate your model. If you want more details, I recommend you look in Chapter 41 of the help files in 2018 version. That provides more details about many of the features of microsimulation with parallel trials which we've discussed. Look out for our webinar series presenting a deeper dive into many of the different features of the software. You can register via the website for more details. Thanks for watching.